me muero, Cupido, Cupido, dame la mano. Ay, Cupido, 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 ay, Cupido, Cupido chiquito, que me muero, Cupido, Cupido, dame un besito. Cupido me fue a ver cuando estaba trabajando, Cupido me fue a ver y me dijo qué has de hacer si te caes, si vas bajando, si te caes, si vas bajando, cómo has de curarte aquel. Ay, Cupido, 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 ay, Cupido, Cupido tirano, que me muero, Cupido, Cupido, dame la mano. Ay, Cupido, 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 ay, Cupido, Cupido chiquito, que me muero, Cupido, Cupido, dame un besito. Pobrecito del Cupido, ¿cuántos más se morirán? ¿Cuántos más se morirán por haber pobres y ricos? Y me dijo el Cupidito, es que no tienen para ir al doctor, no tienen para ir al doctor, pobrecitos chiquititos. Ay, Cupido, 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 ay, Cupido, Cupido tirano, que me muero, Cupido, Cupido, dame la mano. Ay, Cupido, 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 Cupido chiquito, que me muero, Cupido, Cupido, dame un besito. Cupido me fue a ver mientras estaba yo bailando, mientras andaba bailando, Cupido me fue a ver y me dijo, camarada, ves aquellos chiquititos, ves aquellos chiquititos, se nos van a ir a correr. Ay, Cupido, 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 ay, Cupido, Cupido tirano, que me muero, Cupido, Cupido, dame la mano. Ay, Cupido, 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 ay, Cupido, Cupido, mi hermano, que me muero, Cupido, Cupido, dame la mano. Déjeme ir, preciso andar, voy por ahí a procurar rir para no llorar. Si alguien pues me preguntas, dile que eu solo voltar quando me encontrar, quando me encontrar. Quiero asistir a un sol nacer, ver las aguas dos ríos correr, oír los pájaros cantar. Oh, quiero nacer, quiero viver, déjeme ir, preciso andar, voy por ahí a procurar rir para no llorar. Si alguien pues me preguntas, dile que eu solo voltar quando me encontrar, quando me encontrar. Quiero asistir a un sol nacer, ver las aguas dos ríos correr, oír los pájaros cantar. Oh, quiero nacer, quiero vivir, déjeme ir, preciso andar, déjeme ir, preciso andar, para me encontrar, para me encontrar. Thank you so much. Me gustan los estudiantes, jardín de nuestra alegría. Son aves que no se asustan de animal ni policía. Y no le asusta la bala ni el ladrar de la jauría. Caramba y zamba la cosa, que viva la astronomía. Me gustan los estudiantes porque son la levadura del pan que saldrá del horno con toda su sabrosura para la boca del pobre que come con amargura. Caramba y zamba la cosa, viva la literatura. Me gustan los estudiantes que rugen como los vientos cuando le meten al oído sabiéndose que es afrecho, y no hacen el sordo mudo cuando se presenta el hecho. Caramba y zamba la cosa, el código del derecho. Me gustan los estudiantes porque son la medicina del pan que saldrá del horno con toda su sabrosura para la boca del pobre que come con amargura. Caramba y zamba la cosa, que viva la literatura. Me gustan los estudiantes que rugen como los vientos cuando le meten al oído saliéndose que se a pecho, y no hacen el sordo mudo cuando se presenta el hecho. Caramba y zamba la cosa, el código del derecho. Caramba y zamba la cosa, el código del derecho. Era un fósil que soñaba dejar la universidad, y entre sus proyectos estaba salir doctorado en contabilidad. Dicen que un día curar quiso a un gordito en la selección y le dijo: mi hijo es gordura, pero resultaba que era hinchazón, y cambió la facultad por querer ser más abriado, y le juraba la moza con quien estaba casado: voy a volver a estudiar un curso de posgraduado. Era un fósil que soñaba dejar la universidad, y entre sus proyectos estaba salir doctorado de medicina. Mas dicen que curar no pudo, y un paciente hace mención que en consulta un sordo mudo le dijo estornuda, pero no lo oyó, y cambió la facultad porque ser más agraciado, y le juraba a su moza con quien estaba casado: voy a volver a estudiar un curso de posgraduado. estas selvas canta, el eco de mi garganta es el que a ti te enamora. Para una patinadora que por estas selvas canta, el eco de tu garganta es el que a mí me enamora. Señorita, la rana salió, llegó su marido, sí señor, y que le trajo un ropón de qué color, verde limón. Vamos a misa, no tengo camisa, vamos al sermón, no tengo ropón. La botellita no tiene tapita y el botellón no tiene tapón. Quítale, 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 pom, pom, pom. Quítale, 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 pom, pom, pom. No tiene tapón, pom, pom, no tiene tapón. De los hijos de mamá, yo soy el pollo pelón, soy el que todo agarró con mayor precocidad. De los hijos de mamá, yo soy el pollo pelón, soy el que todo agarró con mayor precocidad. Señorita, la rana salió, llegó su marido, sí señor, y que le trajo un ropón de qué color, verde limón. Vamos a misa, no tengo camisa, vamos al sermón, no tengo ropón. La botellita no tiene tapita y el botellón no tiene tapón. Quítale, 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 pom, pom, pom. Quítale, 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 pom, pom, pom. No tiene tapón, pom, pom, no tiene tapón. Latino, tú estás hecho de una fibra muy especial. Si eres latino, tú estás hecho de una fibra muy especial. Estamos hechos de la mezcla del tequila y el mezcal. Somos los únicos capaces de reírnos de la desgracia. Somos los únicos capaces de reírnos de las desgracias. Nuestro país tiene la forma del cuerno de la abundancia. Y en todo el mundo no hay nada igual, no existe en todo el mundo nada igual, no existe en todo el mundo nada igual, no existe en todo el mundo nada igual. Somos los chicos más chidos de toda la humanidad. Somos la raza más chida. Somos la raza más chida. Somos la raza más chida. Somos la raza más chida, carnal. Somos la raza más chida de todo el reino animal. Los emigrantes estamos hechos de una fibra muy especial. Los emigrantes estamos hechos de una fibra muy especial. Estamos hechos de la fibra del sol, la luna y las estrellas. Somos los únicos capaces de reírnos de las desgracias. Somos los únicos capaces de reírnos de la desgracia. Nuestro futuro tiene la forma del cuerno de la abundancia. Y en todo el mundo no hay nada igual, no existe en todo el mundo nada igual, no existe en todo el mundo nada
Welcome, everybody. Glad to see so many people here in the audience. It is a great time to be celebrating social movements. I want to let's give As we stand here at the University of Washington, 206 agitators, along with lots of other student and community organizers, held a walkout on 3 campuses involving hundreds of people. And to quote their Facebook, the student activists declared a state of emergency at University of Washington when it comes to minority students. A walkout is happening simultaneously across 3 campuses in protest. So to be here tonight to celebrate the publication of Global Health Watch 4, and to connect that to the amazing 15-year struggle, which really relates to hundreds of years of struggle for equity in health and human rights around the globe. I want to welcome everybody and thank Jackie for the beautiful music. My name is Rachel Chapman, and I'm a professor of anthropology and an adjunct in global health here at the University of Washington, and I am going to be your hostess for the evening. There are exits at the front of the room and at the side, should you need them. We have an amazing event tonight, but I want you to know that there's still food in the back, although it's disappearing quickly, and that we encourage everybody to get a free raffle ticket at the Global Health table, if you can wave back there. Nicole? Oh, is that Nicole? No, someone else is in the back. Just wave, thank you. And you could win one of these books before they actually hit the shelves anywhere around the world. So this is a really amazing opportunity. We will be raffling 5 of these throughout the evening. We also just learned right at this moment that we have a greeting from our congressman's office. I'd like to introduce David Loud. He's the community liaison for Congressman Congressman McDermott's office, and he is here with a greeting from Congressman McDermott.
Thank you. Oh, it's lovely to see this full house. And this is a very informal greeting. My boss is in the other Washington today trying to do the people's business. And he just wanted me to say that thanks to the efforts of everybody who's collaborated on Global Health Watch 4 and all your partners around the world, for that matter, that Seattle has become one of the key centers of global health work and health justice in the world. And he wants you to know that it's been a real privilege to represent a congressional district that is making such a positive difference in the world. Keep up the good work.
And I think we should send the same message back to our congressman. Keep up the good work. We have so many people to thank for this event, and I'd like to start out by thanking the sponsors who, because of their generous financial support, made this beautiful gathering possible. First, we have Health Alliance International, the University of Washington Department of Global Health, and Doctors for Global Health. Can we give them a round of applause? One of the reasons why Seattle is such an amazing place in the globe to work on topics around justice and social health is because of all the social movements and the organizations that have grown up around the university and around the history of community activism here. And luckily for us, many of those are co-sponsors of this event. So I'd like to thank the co-sponsors for their support: People's Health Movement, the Global Health Resource Center, Oxfam USA, the Seattle chapter of Results, Partners in Health Engage, the Washington Fair Trade Coalition, Jubilee USA, the Somali Health Board, and Community Alliance for Global Justice. Thank you, all of you, for all your help in promoting this event and being here tonight to make it happen. Not only are they sponsors, but they are also participants and voices at this event, and also people that you can engage with around the work that they're doing. So please take the time at the end of the event to do so. I also wanted to mention that we handed out note cards. There might be one under your seat. It might not keep you afloat, but it is used to float your question up to the speakers at the end. So please, during, or even before or now, if you have a question, please write questions, and we will be circulating among you to gather those questions. There'll be time for open questions as well, but we'd love to get some written questions for you, especially the shy in the group. I have one last announcement before we bring up our first speaker. Tomorrow here on the University of Washington campus, we have the great honor of hosting Omar Barghouti, who has been at the front of the nonviolent Palestinian resistance movement, who's going to be speaking tomorrow at Haggett Hall in the Cascade Room tomorrow at 4 p.m. So we would love if people took all of their social activist energy and came to that event and made it as lively and full as this event is tonight. So, and Amy Hagopian is in the front if you have more questions about that. And if you've never been to Haggett Hall.
It's near the hub.
It's near the hub. It is one of the dorms. My first speaker is probably someone who's the best place for us to start. Alex Luger is a primary care physician who works at the Health Point Community Health Center here in Kent, Washington. He's a member of the U.S. Coordination Committee of the People's Health Movement and serves as the secretary for the NGO Doctors for Global Health. And when my students ask, I want to be a doctor, but I want to be this cool kind of doctor who does the kind of social justice work, I always tell them, we'll do a reverse interview. Find a person who's the doctor who has the job you adore and find out how they got where they are. Well, now you have one of these opportunities. Here's Check, Mentor You Need to Know. Please welcome Alex Luger.
Thank you, Rachel. And thank you, Jackie, for that beautiful music. All right. Wow. This is really cool. I'm just so delighted to see so many people turning out to support what this is all about. It's really amazing. And I had a chance to speak with some of you briefly earlier, and it was really touching to hear why you came today and to just see how we're all here for the common goal of social justice and global health. I think that's really wonderful. As Rachel mentioned, I work down in Kent at a community health center. About half of my patients are from Kent, and the rest are from all over the world. I take care of refugees and immigrants from Somalia, Ukraine, Latin America, Southeast Asia. Most of the languages I walk into with interpreters I haven't heard of before. And so global health is a really personal matter to me, because the healthier my patients are, the healthier the globe is, the easier my job is. I work with the organization Doctors for Global Health, which partners with communities, primarily in Latin America, to promote health and human rights. Incidentally, we're having an annual General Assembly here in Seattle in August, and I'm happy to share more information if you'd like later on. As the name implies, Global Health Watch 4 is the fourth book in an important series of books that analyze the political economy of health. This book describes the weaknesses of our current system. It tells us how we got to where we are, and it lays out strategies for achieving health for the whole globe. The book starts with an analysis of the global financial crisis and lays out the repercussions in health that this has caused. It talks about some of the improvements that progressive governments have made, such as El Salvador's human rights-based national health system. It explores the discourse on universal health coverage, and it gives us examples from the United Kingdom, Brazil, Mexico, and other countries that have prioritized universal health coverage. Notice I didn't say the United States. This book helps us understand how decisions at the WHO are made. It helps us understand how trade agreements impact health. It's really a far-reaching book, and for good reason. Health is not just whether you have a doctor nearby. It's not just whether you can go to a clinic if you need to. Some of you took the time earlier to write down what health means to you. And I wonder if anybody would be willing to read out some of these thoughts with us. Would anybody like to share some of the thoughts that are in this hat?
Physical, emotional, and social well-being, being happy and stress-free.
I agree with that. That sounds pretty good. Anybody else?
I think health, the physical, emotional, and psychological and mental well-being of a person.
Very similar. Would anybody else care to share?
Having access to quality health care, not being sick, and able to enjoy my current lifestyle.
Health is really about so many things. And I think that's what makes this book really special. Because this book is exactly about that. This book documents the struggles of people whose health is in jeopardy. It is a testimonial to people whose right to health is violated. I believe that health is a human right. This is a premise that's really important, and it has international agreement. Well, at least it has international recognition. The Universal Declaration of Human Rights identifies health as a human right, and I think we need to start from that premise if we're really to achieve global health. I'd like to take just a few minutes to tell you about the People's Health Movement, because the people who work in the People's Health Movement are largely responsible for writing this, or at least for collaborating to make this happen. There are members of the People's Health Movement in this room, and it's really important that we connect with each other so that we can collaborate globally as well as locally. The People's Health Movement is an international network of people who are working in their own communities and internationally to promote global health. It's an amplifier for the voices of people whose health is threatened. Everybody has a voice, but some people have structural barriers that silence those voices. And the People's Health Movement advocates on behalf of those people. The People's Health Movement is a structure for organizing against the economic and political causes of our deepening global inequalities. And it's focused on achieving health through a rights-based approach, one that focuses on improving the social determinants and determinations of health. In 1978, in Alma-Ata, Kazakhstan, the first international conference on primary care was held in 1978. This was the first major international declaration on the importance of health care. 134 countries were represented there, along with the World Health Organization. And from that meeting, they created and signed on to the Alma-Ata Declaration, which is a call to action to achieve health for all by the year, does anybody know? 2000. Yeah. It hasn't happened 38 years later. And in the late 90s, this was obvious, mostly to people in the global south who really faced most of the health inequities. And so in the late 1990s, they formed the People's Health Movement as a way of challenging global health policymakers to promote health for all and to revitalize the Alma-Ata Declaration. In the year 2000, 1,500 people representing 90 countries went to Bangladesh. And there they had the first People's Health Assembly. This was a forum for people to share their stories of struggle, to collaborate and to join together, to demand that global decision makers prioritize the health of people whose voices are not heard. Since the year 2000, there have been 2 subsequent People's Health Assemblies. These have been opportunities for people to come together and collaborate. And those opportunities have largely catalyzed the work that's in this book right here. The second was in Cuenca, Ecuador, and the third was in Cape Town, South Africa, just 2.5 years ago. This is from Ecuador. In order to understand the factors that influence global health, we really need to understand how the global economy works. This book offers insight into how political and economic policies shape health. It provides case studies of activism and gives us stories of successes. And it lays out a pathway for where we must go if we're really going to have an equitable, just, and healthy global society. I'm just thrilled that so many people have come here today to share in this opportunity. And from reading some of the things that you have shared and from speaking to some of you, it's clear that we're here for a common goal. So I hope you'll take the opportunity later on to meet the people around you. I know we're all facing forward, but really, this is where the action is. I'm excited to hear from people from the community who are doing good work here locally, working for health in their own way. And I hope that you'll have an opportunity to take a look at Global Health Watch 4, because this is a really timely book that serves as a fantastic resource for empowering us in our fight to achieve health for everybody. Thank you very much. Thanks.
Can I have another round of applause for Alex? I'm going to send the attention back to Julia at the Global Health table. She is about to come up, and anyone want to run and get your last, you can still do this till the end, get your ticket and put it in here to get one of these hot off the press books. And so,
we're just going to raffle one off right
the drum roll.
All right.
Get your red tickets out.
First winner is?
The first winner is?
Oh man, it's going to be a number. Okay, 0794579. So we'll have 4 more books to raffle off throughout the event. So if you haven't gotten a ticket, head on back to the table. I'm bringing back the tickets right now. Okay.
Now you've heard the famous, thank you, Julia. You've heard the famous saying that if there is not dancing in the movement, I don't want to be in it. Well, I feel the same way about music and any creativity. I want to take this moment to bring the lovely Jackie back up. Jackie Larrainzar is a queer human rights artivist from Mexico. And if up until this moment you had never heard what it is that you want to be when you grow up, maybe you just heard the word artivist. She is from Mexico in the tradition of Chavela Vargas, Lydia Mendoza, and Woody Guthrie. She uses art, music, film, and performance to create awareness about human rights issues. In 2000, she founded La Pasión Music, a project to support racial justice organizers' well-being through music and sound healing. Her music is part of the Smithsonian's Music of Protests Recordings collection. Please welcome Jackie.
Thank you. Thank you so much. And instead of telling you how sound heals, I'm going to show you. And I want to honor my grandmother who taught me this story that I'm going to share with you and taught me this song that I learned from her. She was the first obstetrician to graduate from the National University in Mexico. And she had a lot of horror stories about being the first woman in a medical school, which that's another conference. But she was from the Basque Country. And when I was little, I thought I was going to be a doctor, and I asked her why she had become a doctor. And she told me the story of why we humans get sick. And so she told me that a long, long time ago, we kind of went crazy. And we disregarded every single agreement that we had had with all our relatives. The insects, the plants, the earth, the stones, the air, the sky, the water. And we just went around abusing them and doing whatever we wanted to do. So the animals called a conference pretty much like this one, because they were sick of us. And they started to think how they could make us to stop. And so, you know, the little lynxes started thinking, yeah, well, we can go into things and make them sick. Yeah, let's go and do that. So some people died because, you know, they went and put into our food some little stuff. And then the deer and the stags and all the other animals in the mountain got together and they were like, well, that was a pretty good idea that the insects had. Why don't we think about how we can do the same so they stop eating us whenever they want to and hunting us and just hurting us for sport? So that's why every time we eat meat without thanking our brothers, we get sick. And the story goes that that's why we get rheumatism and other ailments in our bones and our skins. I don't know, maybe somebody can do some research about that. And so it went on, and then our cousin Bear, who is a very important figure in Basque culture, said, wait a minute, we cannot do the same things that humans are doing to us if we want them to respect us. If we want to see a world where we all can live in peace, we all have to figure out a way of not hurting each other. So Bear convinced all the other animals not to keep doing what they were doing. Otherwise, I don't think we will be here. But the lesson of this story is that there is healing everywhere. And the same way that we go and disrespect anything around us, you know, those same things turn around and hurt us. And that's why we need to figure out how to heal the earth by healing ourselves. This is a healing song that it's been sung in my family for many, many generations. And it's sung when you are feeling sad and you ask the universe, the stars and the moon and the earth, to take away whatever is making you sad. In Basque culture, we believe that when you give the earth whatever is making you sad or heavy, you prevent illness. You don't get sick. Because the beginning of sickness is sadness, isolation, not having a community, not being loved. So if you can close your eyes and imagine what it will be like to live in a world where we all have access to health, where we are healthy, when each one of us is happy and can reach its potential. We're done here, right? So I'm going to give you the song. You can put your hand on your heart if you want, because that's the beat that we always go back to. That's the beginning of life and the end of life. And it's always a circle, like the drum. And whatever you want to let go, let it go.
Aquí esperando.
wonderful to be reminded that healing is everywhere and that we start that process the moment we reach out to somebody else, like you're all doing tonight. The next person who I'm going to call up to the stage is another healer in her own right. I want to welcome Renee McCoy, the Reverend Renee McCoy. She has a PhD in anthropology and a specialty in medical anthropology. She's taught a variety of courses at Wayne State University, Eastern Michigan University, and here at the University of Washington. Dr. McCoy has worked in HIV/AIDS since the disease first surfaced and has been involved in care, prevention, education, and research for more than 33 years. She's the former director of the HIV/AIDS program for the Detroit Department of Health and Wellness Promotion and the past coordinator of the HIV/AIDS Behavioral Surveillance Unit with the Michigan Department of Community Health, where she conducted research that focused on HIV/AIDS risk. She's the former director of prevention education at Lifelong AIDS here in Seattle, a network of local organizations, and one of the founders of a very important new organization here in Seattle called the Multicultural HIV, AIDS, and Hepatitis Network, a network of local organizations designed to address HIV, AIDS, and hepatitis issues among people of color. As an independent consultant in Seattle, Dr. McCoy specializes in HIV/AIDS program design and developing collaborative projects designed to increase diversity. She's currently working with community organizations such as the Langston Hughes Performing Arts Institute, Team Issachar, and Teen Feed to expand outreach to people of color, youth, and the LGBTQ communities. She is also an ordained minister who continues to work to address spiritual support and social justice issues among African American LGBTQ persons. And as I know her best, she is a healer and a preacher. Renee McCoy.
I'm gonna mess this up. I know I am. Can I close this? I just need a place to put my stuff. Okay. You can sit it on the floor. You got enough geeks in this room to fix it. Wow. I'm really honored to be here. I'm a kid from a small Midwestern town, and I'm always amazed when folks ask me to speak, but I'm always honored and humbled and pleased. Thank you so much for having me here, and thank you all so much for coming out. And I always thought as an old activist, when you walk out of class, that was you walk home afterwards. So those of you who walked out for 206 of Black Lives Matter, I really want to thank y'all for coming, because I'd have walked home. The World Health Organization defines health as very much like the young man mentioned earlier. But their definition is that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. I really like that definition, because for me, this is the best point of departure for us to understand how to make the world a healthier place to be. Our task this afternoon is to determine how we, in this country, right here in Seattle, can join as partners in the global transformation of actions and policies that will contribute to improved health for everyone. First and foremost, this requires us to take a closer look at how existing policies and programs interfere with attaining health. It requires that we look at where we are, where we're going, so that we can complete and actualize that definition of health as a comprehensive state of physical, mental, and social well-being. And it also requires that we operationalize ways of bringing life and health to our communities here in new and somewhat different ways. Before we can do that, however, we must understand what it means for us in this country to develop a global perspective. A serious problem for us is the way we seem to perpetuate the idea that global health is something out there, that global health is an issue that only affects developing countries. There is an arrogance in this country that leads us to believe that global health and global health issues just do not apply to us. We live each day convinced that this is the richest, healthiest place in the world, convinced that real health problems are issues for a developing country. I am not surprised that we don't have a United States presence in this book. The truth of the matter is that the United States of America is actually a composite of developing countries simply because we are an amalgamation of developing cultures. There is incredible diversity among peoples of color and ethnicities, all of which have numerous cultural backgrounds, numerous immigration statuses, and numerous and beautiful languages. The truth of the matter is that in spite of the richness of this country and in the midst of the diversity of our population, we really have not developed. Our arrogance, however, leads us to believe that our role in global health and global health initiative is to be the leader, the financier of global health movements, because we as Americans have everything figured out. We got that. Nothing could be further from the truth. Of course, things are comparatively quite well here. I am a proud African American. I'm a proud American who loves this country. In fact, as an African American, as a black woman, and as a lesbian, I don't think I want to live many other places. Things are certainly better and healthier for me here than in most other countries. But it is precisely because of this position of pride and loyalty that I must insist that we not allow our delusions of perfection to divorce us from our responsibilities to participate in global health actions. Our so-called greatness demands that we include the policies and practices of this country as essential components of any analysis of and responses to improving the state of global health. Although suffering looks different in this country, suffering is suffering is suffering is suffering. And our humanity demands that we accept responsibility for ending suffering wherever it exists. The globalness of this country has historically been disguised within a narrative of oneness that in reality has never existed. On paper, we are one people. In practice, however, the United States has never been the land of the free and the home of the brave. Rather, we continue to be a land where freedom is conditional and bravery is an ideal, a commodity we promote in political circles. Our practices as a country tragically convict the basic tenets upon which this country was founded and expose us as severely lacking in providing health to all. Our wealth positions us as rich and powerful. Our practices, however, set us squarely in a quicksand of brokenness and reveal the reality that we, like the rest of the world, are still developing. It is within this context of global citizenship that we must work to place our arrogance aside and join efforts to address the health needs and challenges of the planet. This is not about what we can do for those people. It is about what we can do for our people, and it is about what we must do as people. There are numerous approaches to our responsibilities to global health, but we must each find our own place from which to operate. As a person of color, that place for me is recognizing and responding to a multicultural health agenda. It's about expanding efforts and policies to include real-life challenges facing people of color in this country. Now, I was raised to believe that what is good for white people is, by default, good for me. We know how that story proceeds. The good for my people has never been the greater good. I submit that we reverse these lessons and consider that what is good and healthy for people of color will, by default, you know what I'm going to say, be good for the world. I submit that we consider that what is good and healthy for people of color will, by default, be good and healthy for this country. If for no other reason, consider that by the year 2050, it is projected that people of color will make up the majority of the population in this United States. If things continue as they have been going, this means that the majority of the people in this country will be low-income, low-wage persons with poor health and limited possibilities. This is unacceptable for me and should be unacceptable for you and other humans on the planet. In order for us to change the future of health throughout the world, it is imperative that we make radical shifts in how we in this country construct and operationalize a multicultural health agenda. And by that I mean one that is driven by a serious commitment to addressing social determinants of health, those inequalities in social and economic conditions that contribute to the risk of illness. A multicultural approach is also about much more than race and ethnicity. A true multicultural approach considers the role of social determinants of health also for persons who are at increased risk due to other issues, such as age, sexual orientation, and gender identity. Aging individuals and children don't have enough to eat or safe, clean places to live. LGBTQ persons continue to be limited by policies that restrict and condition access to care, mental health and substance use treatment, education and employment. We live in a society where tolerance is thought to be enough. It's not enough. To bring about health, however, we are challenged to do more than simply tolerate difference. Genuine inclusion requires that we actively celebrate difference through thoughtful and respectful acts of empowerment. We have done well in appropriating the exotic. We imitate rap artists. We fill our closets with urban influence clothing. We serve fatback at animal entrails and high-end restaurants. I am always shocked and appalled in Seattle at how much I have to pay for pig feet. Shocked and appalled. Back home, they 5 pounds for $1. Here, they're an exotic commodity. And I'm still trying to figure out, with all due respect, if there's anybody in here, I'm still trying to figure out how white folks get dreads. I'm still trying to figure out when white folks began wearing braid extensions and where they buy them. We have got to understand that inclusion is more than the appropriation of the exotic. So what do we do? How do we move forward in an effective and genuine partnership in global health? That's a really difficult question to answer in the little time that I'm allowed, but I'm going to give you a few suggestions. The first is that we must establish collaborative and supportive relationships with, actually, you know, if there were more black people in here, the thing about the dreads would have been funny. You know what I mean? I just had to say that. You know, I heard y'all chuckling. You got it. Y'all got it. I know. Y'all got it. It wasn't me. It's them. All right? I just had to put it out there. You got it. I know you got it. See, that's what it's about. Anyway, We could begin by establishing collaborative and supportive relationships with community-based organizations that are working to build stronger, culturally appropriate, and responsive communities. So often we want to save community organizations rather than be in partnership with them. We tend to listen with our sophisticated educations rather than with our ears and our hearts. CBOs that serve multicultural communities don't need us to fix them. They need us to work with them. They need us to support self-determination without expectations of ownership. This means helping community-based organizations access such things as training. It means helping them learn to evaluate their programs in order to make them more effective. It means helping them learn how systems work, as well as helping them learn how to work this system. It also means setting our arrogance aside long enough to understand cultural meanings and practices that may not be what we are used to. Practices and meanings that are nevertheless essential and effective to communication, health, and community engagement. A second thing we must do is engage faith communities in our struggle for global health. Anthropologists have known and have maintained throughout the ages that relationships with higher powers are characteristic of all cultures. Relationships with sacred entities have been recorded since the beginning of humankind, and most cultures rely upon some degree of participation with sacred beings and religious doctrines. Faith communities continue to have tremendous influence on policies and practices throughout the world. For people of color, especially black people, such beliefs are critical. Engaging faith leaders and groups can be pivotal in changing public health policies. This requires, however, that we take the time to meet them where they are. It's not about challenging and changing beliefs. It's more about finding places where we can agree to work together to make life better. It's about agreeing that all life is sacred, and as such, humans deserve the right to health. On some level, engaging faith communities is about reminding them that the body needs to be healthy before the soul can be revived, whatever that means. A third consideration is intentional outreach and collaboration with specialized populations, those people that we consider difficult to reach groups. I've grown quite weary with hearing that individuals representing our oppressed groups cannot be found. Whenever we get ready to do community organizing, we can never find the people we're trying to fix. It always amazes me that we can find people of color to clean our houses and landscape our yards, but cannot find them to sit on our boards, teach in our classrooms, or run our businesses. Intentional outreach and collaboration requires that we approach inclusion at the community level with the same rigor we use for exclusion in our own lives. I'm not making friends, I can see that. I didn't come for friends, I came to talk. The fourth thing is that we educate people in this country about oppressive policies in other countries and establish advocacy partnerships that engage the power and resources we already have in this country to address human rights violations everywhere. We hear a brief news flash about something happening in another country, but that information rarely sinks into our lives. For a moment, we feel bad that hundreds of young black girls were kidnapped for a moment. When an American gets Ebola, we panic because we're afraid of the virus that might put our communities at risk. we don't understand, or we don't admit, that when the Ebola virus surfaced a decade ago, we simply felt sorry about what was happening to them, and we sent our missionaries to handle things. Oppressive policies demand education about why violence and disease over there is our business over here. Advocacy demands, for example, that we work just as hard to educate our communities about policies that meet homosexuality with capital punishment or imprisonment in countries such as Uganda, Singapore, and Russia. That we work just as hard to address capital punishment for homosexuality there as we work to pass same-sex marriage here in this country. We should be as upset about a lesbian being murdered in Jamaica as we are about same-sex couples not being able to get married in Michigan. Finally, we must activate strategies to join efforts to improve global health by developing what I call a both-and position on policies and practices. Interestingly, in some ways, we have done a better job of making HIV and AIDS prevention and education and medication available in Africa than we have in Alabama. Still, today, almost half of the people living with HIV and AIDS in this country are black, while we are less than 14% of the country's population. This is unacceptable. There are 45 million people in this country living in poverty. This is unacceptable. 1 in 7 households in this country are food insecure, and almost 7 million more report not having enough to eat on a regular basis. This is unacceptable. There are hundreds of thousands of households with children and hundreds of thousands of older people who are starving in this country. Our children can't read. Our homes are unsafe. Our environments are toxic. Our youth are bullied. Violence permeates our neighborhood. Our air is unclean, and rage courses through our veins as we realize that lives just don't matter. It's not just about black lives not mattering. We have come to the real and unhealthy realization that black, gay, Hispanic, poor, young, old, transgender lives don't matter, and they should, and that's unacceptable. That is unacceptable, and that is unhealthy in the United States today. Both and policies and practices address the rights of all people to enough food, to enough clean water, to enough dignity, to enough respect, to enough health. The global health challenge for us in this country is to take a comprehensive agenda seriously and utilize our resources to ensure that all people have access to whatever it takes to be healthy. A true and effective and efficient global health movement requires that we join together to guarantee that all people live in a state of complete physical, mental, and social well-being, and not merely without disease or infirmity. Tonight is the sounding of that call to action. Thanks, guys.
Can somebody say amen? Amen. 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 And the word is living. We are going to do 2 more raffles. Thank you again for the music and the music. We have 2 more books to be raffled by Julia.
Okay. All right, you got your tickets. The next one is 0794603. You want me to read it again? 0794603. Must be present to win. All right, we're going on. Okay, sorry about that one.
Oh, we found it. We found it.
We found it?
Yay!
Oh, come on up, Salsa. Fantastic. All right. Here comes the next one. All right, drum roll, please. 0794587. Yeah, come on up. Oops, I just put it back in there. All right, we've got 2 more at the end of the program, so stick around. Must be present to win.
And there is still time to go and put your lucky ticket in the vase. The next part of our evening tonight brings up activists from 5 different organizations. They're going to introduce themselves. They are different social justice organizations from around Seattle, and they're going to be giving an overview of their organization and how their work connects to the larger struggle for health for all. So welcome. We're going to begin with Julia Robinson from HAI.
Hi, everybody, and I have a quick announcement. It seems like a guardian angel has brought more food, so after the event, you can feel free to go and chow down a little bit more. So how many here have heard about Health Alliance International? Oh yeah, extra credit for attending. Great, well I will just do a brief overview of what we're all about. My name is Julia Robinson. I work on the Côte d'Ivoire and advocacy programs at Health Alliance International. And we are a center of the Department of Global Health. So that means that we are affiliated with UW, but we're our own independent organization as well. Currently, we have health programs in 3 different countries, in Côte d'Ivoire, where I work with my boss, Awa Kone, who's here today, in Mozambique, and in Timor-Leste, which is a small country near Indonesia. So our health programs, we partner with the ministries of health in all of these countries to strengthen health services overall, and really work in solidarity with the countries with whom we work. We're not an organization that goes in and builds clinics and runs independent medical facilities. We really believe in working side by side with our government partners to strengthen overall health systems. We also do a lot of advocacy work, and working with the People's Health Movement is part of that. We work on issues related to health system strengthening, so we have a lot of information about our NGO Code of Conduct, which Adam has over at our table here. And we work on issues of austerity and how that affects health around the world as well. So please visit our table if you have some time. We're right here in the front, and you can sign up for our mailing list, and we have all of the Facebook and the Twitter and all of that stuff too. So the best way to get involved would be to start there and then reach out to us, because we're always looking for young engaged folks and old engaged folks and anybody who cares about these issues. So please look us up.
Hello, I am Bobby Riggi. I'm here representing the Community Alliance for Global Justice. This is an organization that's been around about as long as these books have been coming out. Started after the big demonstration against the World Trade Association in Seattle. And now its main focus is on food and food sovereignty. And although there are 3 aspects, one is trade, and we support the Washington Fair Trade Coalition. One is about food justice in this country, and one is about food sovereignty around the world. I want to read a definition of food sovereignty. It is people's right to healthy and culturally appropriate food produced through ecologically sustainable methods, and the right to define their own food and agriculture systems, the democratization of food systems in favor of the poor. And we, of course, are struggling here about GMO food. There's a demonstration at Costco against GMO salmon next Saturday the 7th. We also worked, or have worked for years, with farmers around the world, and in particularly in Africa. And you may have heard about this. In October, we sponsored a big US and Africa food sovereignty strategy, which involved farmers from this country, small farmers, and food activists and farmers from Africa. And out of that came a statement, which I'd like to read the end of. All these organizations said, "We pledge solidarity with the struggles of each of our organizations and with the global food sovereignty movement, and will work in mutual support to amplify the voices of the people on the ground, fighting for food sovereignty, share information with the general public about food sovereignty and agroecology, and, very importantly, expose the myths underlying the false idea that corporate agriculture is necessary to, quote, feed the world. So I'm very happy to read on page 198 a statement about food sovereignty, and I'm so happy I won a book.
Thank you. Hi, everyone. My name is Nicole Advani, and I'm fortunate enough to be a part of the undergraduate global health community here on campus. I'm involved with various courses, and I actually get to work at the Department of Global Health and intern at HAI currently, which is great. But I kind of wanted to focus and talk a little bit about the two organizations that are on that far back table, Partners in Health Engage and the Global Health Undergraduate Leadership Committee. So the Global Health Undergraduate Leadership Committee, GHLC for short, is kind of a group of us that are trying to raise awareness about global health issues within the community, not only within the global health community, but just the undergraduate and graduate community in general. And we talk about the minor a little bit that we're all involved with, as well as other organizations and activities that we get to partner with. Partners in Health Engage is another organization on campus, and we also raise awareness about various global health issues, both on and off of campus. We partner with some other communities around the Seattle area and organize events to educate our community a little bit more about global health issues that are local as well as global. So hopefully, if you guys are interested, feel free to go back there. We've got some informational brochures and sanitizer and sign-up sheets, so feel free to check that out. Thank you.
Hello, everyone. I am Mohammed and Mohammed Ali. On behalf of Somali Health Board, I am so delighted and honored to be here tonight with you. I was expecting to talk something else, but when I have met and see what's going on here on this social movement for health equity locally here and globally, that is something that really I have been involved, and we are part of it because of living through the tropical medicine challenges that we had back home, and then moving due to circumstances that we faced back home, due to Warsaw, NATO, political influences, wars, and poverty that was due to some circumstances that we lived through, and then living in a world that really things have totally different communities from all around the world, especially African communities in this area, have faced a lot of challenges. And that's the time that, because of the training that I have had with global health, all my professors are here, James, Amy, Steve, and Rachel, because of that kind of equipment and training from here, that ignited us to do something and be part of that movement locally before we move to overseas. So since then, we have been running around in King County and Washington State to make a difference in the communities that we found ourselves in and the situations that we found ourselves in. Because living in the United States and being the most and having the social and health outcomes comparable to Africa, the people living in Africa is sometimes better than, because there's a lot of challenges that communities face. So when you see those kind of challenges, then that's the time that you take your sleeves and do something about it. So that's how this community of Somalis or other professionals from African backgrounds came together to make a difference in this area. So that's how Somali Health Board was founded 5 years or 3 years back, and I am really honored to be part of that. As a co-founder of Somali Health Board, our highest endeavors is to improve the health outcomes of the refugee and immigrant communities from Africa, especially Somalis. We happen to be educating providers, communities, to reduce the health disparities. Because our communities were named hard to reach, That is the terminology they use. It is hard to reach. They don't blame themselves because they don't have remedies. They don't have the solutions for solutions. So that is the things that when, for example, let me give you. The activities that we have done, they name communities because they say they don't access prenatal health care, prenatal ANCs. The access, they call it sometimes, it's about 30th or 40th percentile. But when we given them the opportunity to communities to have birth-centering programs in locally here, we have seen people overbooking our services. For example, participating, even compared to Caucasians, to other communities, something that we partner with Public Health King County and also now partnering with NeighborCare in Columbia Clinic. So those are the things that's really needed, and it doesn't come, and people will not give you unless you stand for it, and that's what we are proud of it, and that's why we are part of it. And thank you, part of that. And then our table is here. If you need, you can find our information. So Yasmin, Sumaya, Hani, and Leah are also here. So we also, given the opportunity with public health students to come and work with the communities. Study, service learning students, we're giving that opportunities, and there's more opportunities to come. So please feel free, if you are a student in public health or any health, please, we are there for equality, equity, and social justice. Thank you.
Hello, my name is Karen Gillen, and I'm a volunteer and the Seattle group leader for Results, which is an organization headquartered in Washington, D.C., with chapters in over 100 communities around the country, with affiliates in many other countries, particularly developed countries that have lots of money. Our mission is to fight global and domestic poverty and the worst aspects of that poverty. And one key component of that, of course, is global health. Now, I don't know how many of you would ever have the desire that when you see inequities happening or an organization is doing something wonderful in the world, that you would love to be Bill Gates and have your own philanthropy where you could dedicate billions of dollars to solving the world's ills. I know, I really do wish I had that. But our organization offers each of us an opportunity to leverage billions of dollars, actually. Results is a grassroots organization. We lobby our elected officials. We train ourselves on the issues. We actively meet face-to-face with our representatives and our senators. We write letters to them regularly on the issues, and we also write letters to the editor and blog posts, influence editorial boards and op-eds, and get the issues out there in front of the community to create the political will to end poverty worldwide. The US spends less than 1% of the GDP on foreign aid, but believe me, that's still a very large pot of money. And it really belongs to all of us to say where that is spent, what it's spent on, and make sure that it's used in the most effective manner. For example, I don't know if many of you have heard about the Global Alliance for Vaccines, the Gavi partnership, but they have saved over 440 million kids who were immunized since 2000, and their funding at the current round is up this year. And they're seeking, and they sought actually in January at their funding conference, to get another $7.9 billion to carry forward the next few years to immunize another 300 million children and save 6 million lives. Well, for the first time, the US government pledged a multi-year pledge at that conference, $1 billion over 4 years. That also catalyzed other donors to increase their donations, so the total came to $7.9 billion. Interesting, leading up to that, Results volunteers around the country spent the last 10 months advocating heavily for this to happen. There were about 185 pieces of media published, either by results partners or influenced by results partners. And that was about 90% of all media generated on that topic during that time. We met with most of our representatives and senators face-to-face on at least one occasion, oftentimes more. So what I'd like to offer to all of you is, you've heard a lot tonight about advocacy and becoming aware of the issues. Well, we take that one step further. We actually take action and make things happen. And so if you'd like to stop by my table, you could either sign up for our mailing list. We also are offering something called a Real Change Fellowship for young people, where you go to Washington, D.C., meet with your representatives and senators. You learn about advocacy, how to effectively advocate, and you get involved in actually working in your community. So hopefully we'll see some of you over there tonight. Thanks.
Let's have a nice round of applause for all of the speakers and ask them to come back up with a chair for questions. Here's our first question. Could Mr. Ali tell us about the Somali remittances problem?
Yeah. Thanks. So, let me see what I was working. Yeah, there is an issue that we have with the US Treasury Department or anybody who made that decision, which blocks the cents or the dollars that I earned through work for me to have that opportunity to send to my mother or dad or relatives back home who are not lucky enough, who are not fortunate enough to join me here. So that is really devastating. I don't know how to talk to them, or we as a community facing that challenges, labeled as helpers of enemies or something that we don't know what they meant, is really happening. And that is the work that we are trying to write about it, talk about it, and also we need your support in that regard. Because frankly, what I'm telling you is, you are familiar with banking, you are familiar with Western Union or any other money transfers that you use. But as not only Somalis, generally speaking, Asians or Africans, and there is methods that worked for years before banking came to be. That is the trust-based system that's called Hawala, that has really very efficient, works best for us, because $100 you pay only 5% and your family members receive in milliseconds. So, for example, if I go to a business Hawala here and give it to my dad, and then before the sun breaks or before the morning, he receives it. He gets a call, whether he lives in a rural area, remote area in Somalia, or in Africa, or in parts of the world. If I use Bank of America or any other banking system, if I use Western Union or any other Western money transfers, they can deliver it before maybe this month is over. So what we are facing now is someone somewhere is trying to block us from doing that thing, which was ineffective since February 6th. Nobody of us can send $1 to his family in Somalia or in Kenya, in refugee camps, wherever they are. And we are working on an op-ed letter to make that being heard to newspapers, influence policies, and write to our governors. And we have a lot of congressmen, and also Adam Smith is on board. There's a lot of people who are working on this on our behalf, but that is really where we need help, because it's easy to target groups and label them with names. Muhammad Ali sending one penny to his family does not mean he is sending to enemies. There is a political and other functions that creates wars, and there's a lot of things that you do as a government, as someone. So that is really the challenge that we have facing, and then that's the support really we need. Thank you.
I just wanted to add on quickly to what Mohammed has very well covered. My name is Hani Mohammed. I'm a public health major, senior graduating this year, and I just wanted to put a number on the figures that Mohammed is talking about, because we're living in America, and America loves numbers. So it's about 4.1 billion is the amount that we, 1.4 billion, sorry, is the amount that we as refugees here send back home, because some of our family members didn't have the privilege to come here and to attain that better life, and that's about 3 or 4 times as much as we get in federal any kind of aid that Somalia receives. And I think it's this idea is cutting off the hands of people that feed a nation is pretty much what's happening here, because if we were to go the Western Union route, these hawalas are in those rural villages where, Western Union cannot go to. You know what I mean? There's a hawala in, places that businesses aren't usually, can't function there, because these hawalas are run by people who are from the country or who are from Somalia, and this is because of this fear of, we know why this is happening, and I think a lot of people don't understand that. Yes, it's happening to Somalia, but it can happen, and it will happen to various other countries, not just in Africa, but throughout the world. And as a member and as an officer for the Somali Student Association, if any of you are interested in writing to your representatives, we have templates that are already ready to go. Just to make it easier for you all, we have templates that are already ready to go, and if you're interested in sending emails to your representatives, speaking to your representatives, you can come see me or Samaya, and we will definitely write down your email and send you that letter that you can hopefully, trickle into some kind of change. So thank you.
Thank you. The next question is for Nicole, I believe, for Partners in Health Engage. For our third speaker, big smiley face. How to utilize resources, as you mentioned in the speech. What has been done on a community level? If this is not for Nicole, we can also pass that to other organizations to talk about.
I can talk a little bit about what PIH Engage and GHOLC have done. Actually, since a lot of you are students, if you walked by the quad, I believe it was a couple weeks ago on a Wednesday, and if you saw all those, I can stand up so you can see me. Thanks, Rachel. If you saw the red flags there, and we had little sandwich boards that were explaining what they were there for, Partners in Health Engage actually got together and we made 8,966 flags to represent the deaths from Ebola in West Africa. And it was just to raise awareness about what was going on, and that the sort of media around it has died down a little bit, but that doesn't mean that it's not still an issue, and that there isn't still need to pay attention to it and for people to act on the issue as well as other issues. Last night we had a film screening that James Pfeiffer spoke at. I don't know where he's run off to. There he is. Sorry, I caught you red-handed back there. That he spoke at as well, and we've been sort of, as of now, our focus is a lot on advocacy and awareness and raising that awareness in our local community. Similarly with GHOLC, we are also doing similar things. We're raising awareness and hosting events on campus. As students, we're just kind of kicking off and getting traction and building that support within our community and doing a little bit of fundraising and things like that to give back to Partners in Health and to give back to various organizations that we've been a part of. And there are a lot more organizations events that are coming up this Friday and the next week and the next month as well. So if you are interested in being a part of it or just attending, head back there. We've got a ton of really cool ones coming up with global health and the arts and storytelling events and things like that. So definitely a cool way to get involved and learn more about the organizations that are available on campus. But I know there are a ton of other organizations that are doing good work too, so if anyone else. No? Yes? Maybe?
Anyone else like to answer that question? There's another question that's for everybody. It's not lack of funds, but global health programs that center the social justice framework. And multicultural agendas are hard to get funded. What's your suggestion for changing the global health funding paradigm?
Wow. I'll take one aspect of it. Actually, we advocate very strongly for organizations like the Global Partnership or the Global Fund to fight HIV, AIDS, TB, and malaria, because it's a multilateral organization with multiple different governments around the world involved, plus private enterprises, philanthropies, other non-governmental organizations. And what they do is they develop the programs, and individual countries then can request and work together with this partnership to implement a program. And so the funds that are raised and the programs that are developed are not specifically to enable one country to try to influence another. In other words, it's not sending aid in exchange for being an ally or something. So it really can go to the most needy places and do the most good. So we are advocating for these partnerships that cross country borders and private and governmental entities.
Thank you.
I'm going to speak for another organization I work with, Jubilee, which fights the debt that third world countries have to pay to wealthy countries. And the Ebola would not have ravaged the countries they did so much if the health systems hadn't been torn apart by structural adjustment policies. And this is all driven by policies of this country, just like policies keeping people from sending money home. But the structural adjustment policies and the debt is a big part of what needs to change. That should not be there. Countries should be allowed to spend money on their health system, on their education, on the well-being of their citizens, instead of paying the IMF, Bank of America, and other Western banks. And I just want to add, I didn't know that number was very important, because if it's 1.4 billion, no wonder they don't want you to send it over the regular thing. They want you to send it through the Bank of America and Western Union. It's a ripoff. And we should work on that too.
Between questions, I'm going to give an opportunity for an announcement about an event coming up in the arts and global health.
Thank you. So there are actually two events coming up, the Arts and Global Health. One is a week from this Friday, and this is the storytelling event that Nicole mentioned a couple minutes ago. And it's an opportunity for undergrads and community members to come and hear people tell their stories and how they think their stories relate to global health, to equity, and to inclusion. And that's sponsored by Partners in Health Engage. And then a future event after our spring break for students is a month-long, really, exhibition at Cafe Solstice that the Global Health Undergrad Leadership Committee is putting on. Alec, do you want to say a little bit more about that? Sure. We hope to see you out there. It's going to be a really great way for creative juices to start flowing and to involve people from other communities that might not study global health on a daily basis.
Hi everyone, I didn't know I was going to be talking, but so the Global Health and the Arts event was an event 2 years ago put on by G-Hulk, and so we're trying to revamp it. We're going to have visual art in Cafe Solstice the whole month of April. We should have a kickoff event at the beginning, and we want to have a performance art show, location TBA, but if you're interested in being involved, you have friends in this line of work, please email me, awsully with a Y at uw.edu, or contact anyone at G-Hulk. I'm very, very excited for this event. It should be really awesome.
Thank you. Creativity in the house. I have a question for Julia Robinson about HAI. The question is, Could Julia tell us about what the HAI advocacy issues are? What are you working on? What are you excited about? What can people get involved with?
Yeah, no problem. Thanks for asking. At HAI, we are working on what we call 4 advocacy pillars. So we have 4 major areas in which we're trying to focus our somewhat limited capacity, I guess. The first is health system strengthening, and so that has to do with what I spoke about earlier, which involves partnering with ministries of health across the world. It also takes a real critical look at how NGOs, and spoiler alert, you know, HAI is an NGO, but we do a lot of really bad stuff in developing countries, and trying to do good, a lot of times we do bad, in that we sometimes steal health workers away from the government and employ them ourselves. Sometimes we make a real management burden on ministries of health because NGOs come in and they have millions of different projects, and it's somebody's job in the Ministry of Health to track all of those. And a lot of times NGOs will be doing the same exact work in the same exact place, and they're not coordinating with each other. So we, along with a group of other organizations, created the NGO Code of Conduct for Health System Strengthening. And basically it's a way that NGOs can commit to best practices and agree to try to do no harm in the work that they're trying to do good. And we've got a ton of information here up here about that. I think it's one of our really exciting projects, and I would encourage you all to take a look. We also work a lot on macroeconomic justice issues. So this, you know, overlaps a lot with the Washington Fair Trade Coalition, with Jubilee, with Community Alliance for Global Justice. We're really interested in talking about how harmful IMF policies over the years have affected health in the countries in which we work and across the world. You know, where countries are facing situations like Liberia and Guinea are paying more money in servicing debt than they are on their government's health budget, and that's a problem. And that's a problem that we are in a position that we can advocate on and do something about to change. Our third pillar is the effect of war on public health, and this is where our good friend Amy Hagopian is really our champion, looking at some of the issues we focused on in the past include, we've helped co-sponsor an Iraqi physician come to UW just last December, talking about how there's been an epidemic of birth defects in Iraq, and a lot of this is due to the US involvement in perpetuating war in that country, and all the military junk that we left behind caused a lot of environmental damage and environmental exposure to mothers and their kids, and there's been an epidemic of birth defects. So that's just one of many issues that we're tracking. And finally, our last pillar is a relatively newer one. It's race and class equality, and that's looking at kind of bringing the global local. We have had a lot of work in developing countries, but we also have a lot of work to do here at home. So we're still developing some of those activities, but it's one of our priorities. So a lot of action, a lot of opportunity to get involved, and I'm so pleased that, I mean, a lot of the faces here on some of these tables have been involved with us, and if you're interested, like I said, just please, please get in touch, because we would love to work with you.
We have 2 more questions, and the next question is for Alex, I believe, but anyone can chime in. Alex, what makes Global Health Watch for an alternative health report? Can you tell us how is it, in a way, a critique, and how is it an alternative to what we usually hear?
So it refers to it being an alternative to the World Health Report put out by the World Health Organization. Stand up, yes, oh, sorry. So the World Health Organization puts out a World Health Report, and the World Health Organization doesn't have a lot of money. And so they have to rely on funding sources that have particular interests. They have to rely heavily on the IMF and the World Bank. And the policies of the World Health Organization are noble, but there's a lot of influence that dictates what they do and say. The People's Health Movement, sort of in a way of offering oversight, conducts something called the World Health Watch. And at the World Health meeting annually, where all the delegates from the different countries are coming to discuss policy, different members from around the world who belong to PHM, they go to the World Health Organization and they review the documents that are going to be discussed that day, and they develop a critical analysis of those documents, and then they show up to the debate and they hand them out to the delegates, and they participate in the discussions, and they say, hey, in my community, this is an issue, and we think you should think it's an issue too. And so, as an alternative World Health Report, this is really this is really from the people of the world and not from organizations or governments. And in that respect, it's an alternative.
We have actually two other questions. This one is for anybody. A challenge that I have is how can community groups locally work together to achieve a greater impact? Any suggestions? It's open to anybody.
Yeah. Hi. My name's Adam Granado. I also work for Health Alliance International. I just have one little piece to add that I think to acknowledge that, like, right here, right now, today, we have a group of local community-based organizations that have put their resources together, used their mailing lists, used their social media outlets, and brought together a lot of information to share with everyone that's here and share amongst themselves. So I think just as a start, finding ways to band together, to extend the outreach past just what our mailing list looks like, but also when we have these like-minded organizations to bring them on board. We have members from the CAGJ who come to HAI's advocacy meetings as community representatives. So just sort of that engagement is just a great place to start, and I'm sure other people have a lot of other input as well.
Anybody else wanted to jump in?
Hi, my name is Yasmin Habib, and I'm a recent graduate of the University of Washington. Thank you. I wasn't going to say anything or speak, but I think this is a great question to answer. So I'm here with the Somali Health Board, but also on my own, I've recently started something known as the One Mind Movement. So we have a Twitter page up, and let me just read a quick definition of what this is. So it's a Seattle-based project geared towards the global movement of conscious and holistic living. And basically what we're trying to do is really just get people together and go do something about whatever that they're passionate about. Whether, for me, it's education and really involving the youth of our community. So one thing that we are currently doing is we're organizing something known as the Compassion Campaign, and it is led by youth, the youth of Seattle. So we're encouraging people to become a part of the movement. And if you're interested in this, please come and talk to me. I'll also be having conversations about the Somali Health Board, but if you'd like to be a part of this movement, One Mind Movement or OM, please come have a conversation with me, and I'll definitely get you linked to the Twitter page, the Facebook page, and a mailing list. So yeah, thank you.
Case in point, HAI's Twitter just linked with the, One Mind Movement Twitter. So there's a connection that we now have.
Great, and please feel free to Twitter this account, GHW4 or GHW4 Seattle. The last question seems to be a question and a comment. Seattle is the site of one of the most important Indigenous wellness research institutes and is about to open an intellectual house, the first of its kind on campus and in the area. How can this kind of organizing reach wider to include local and global Indigenous health and healing movements? Hartivist.
Well, see, I think the question is really, how can the healing traditions of Indigenous people be centered in a house like that? Because the world vision that most Indigenous people have is very different than what most of you would have. And the traditions are very alive today. I don't know if you know this, but in Mexico, in Michoacan, in a tiny little town called Sinsunzan, Michoacan, they just created the first herbalist clinic in the world. So they went and interviewed all the elders that had knowledge that has been passed for thousands of years about plants and how those plants are used. And they created a clinic where you can actually go and be treated by the elders, and you can learn about the plants. They have a library of plants that you can access and learn from plants that actually are now extinct, but some of the people save little pieces and seeds of those plants, and now they're trying to bring them back. So see, there is this whole philosophy of taking care of the world and taking care of a lot of knowledge that was lost when people came to colonize the Americas and other indigenous peoples in Australia. This happened everywhere, in Africa, in Australia, in Antarctica, everywhere. We lost huge parts of culture in seconds, and so now we're trying to recreate it. So what we really need is people to give us the space to recreate what was lost, and just make a space for us to be able to share with you what we know, and be open to learn this very different point of view of very holistic ways of healing and seeing what makes people sick. And there's a lot of wealth here in Seattle around that also. You can go to Bastir and meet people from the Amazon that heal with herbs and plants and food. You can go to to Puyallup and meet people from the Purepecha Nation who heal with honey and other herbs. So it's just a matter of, I think, switching the paradigm and redefining what healing knowledge is. So there you go.
I think we're out of questions, and that seems like the perfect place to end the questions, unless someone has a burning point. So one more round of applause for all of our speakers and participants.